We now turn to a security expert for insights. Joining us is Dennis Amachree, former Assistant Director of Nigeria's Department of State Services, DSS. Hello, Amachree. It's good to have you with us. Well, our reporters recently interviewed two nurses who were abducted and forced to treat terrorists in their camps. In light of this, what strategies can authorities implement to prevent terrorists from using kidnapped medical personnel as battlefield medics?
Thank you for having me. There is nothing that can be done to stop them using medics in the battlefield. That has been a normal thing that has been going on. But the other way to stop it is to make sure that it didn't happen in the first place. That means that all medical areas, medical facilities should be well guarded and protected, and of course the medical workers are supposed to be oriented to what is going on so that they don't fall prey to these guys.
All right. How does the continued targeting of healthcare workers by militant groups impact Nigeria's broader fight against terrorism?
One thing we have to realize is that our medical or healthcare system is very fragile at the moment. And as fragile as it is, if we start losing some of the medical staff to terrorists, who will abduct them and take them there and then keep them, to be treating wounded terrorists and wounded victims, that affects our healthcare system. Because right now we are talking of shortages of doctors and shortages of nurses, in our healthcare facilities, and then now we have to give up some of them to terrorists. I think it's something that we should look very closely at, because it is something that will really affect us.
Well, now let's shift focus to the U.S. suspension of aid and its potential impact on security. Now, terrorism is a global threat, and groups like Boko Haram and ISIS affiliates operate across borders. Now, with the halt of U.S. aid, how could this affect counterterrorism efforts in Africa?
The new president of the United States have decided that America first. And it does not want people to just spending American money. Because come to think about it also, you find out that although these aids are coming to these different countries, sometimes the aids are misused. So it is time, I think, even for our government to start thinking inwards, look inwards to make sure that we find alternative means of trying to help our security or even economic development inwards, not to be depending on handouts from foreign countries, especially the United States.
Now, you mentioned alternatives. What strategies should African nations adopt to strengthen their own security? Do you believe Africa currently has the resources and infrastructure to reduce dependence on foreign aid?
African leaders and African governments should try looking inwards, just like I said. They should look inwards and see alternative means of taking care of themselves. Because when you look at the kind of aid we get, about $11 million a year, or like I said, about $8 billion in the last 10 years, and you find out that there are alternative sources of what are we doing? There are looted funds that have been recovered. Why don't we use those looted funds and then use it for this particular area of aid, instead of waiting for the aids? The aids will come, and then of course some people are going to fritter it and put in their pockets, and then of course we continue depending on those aids without doing much.
All right, now Dennis Amachree, former Assistant Director of Nigeria's Department of State Services, DSS. Thank you so much for the insight.